So I had a great opportunity. I overheard my bosses talking about that the organization needed to respond to what was going on in the world of Ebola. We've never had to ask patients if they've traveled or if they've been exposed to anything. So what does that look like, and where do you ask, and when do you ask?
We've been partnering with NEW Community Clinic for a long time, and they approached us really looking for a way to get onto an electronic health record. I think about it a lot when I'm sitting at the table and we're talking about different types of projects, and I catch myself kind of using my nurse training or my nursing approach to different types of problems, which really causes you to think differently or take a different approach than maybe somebody with strictly an IT background would take. It also gives me a greater understanding of some of my customers. So thinking about those nurses on the front lines taking care of those patients, having been there, it's been a while since I've actually practiced myself, but understanding what it's like and some of those challenges and what are the tools that we can put in their hands to help them better take care of patients.
We didn't know how the Ebola scare was going to evolve. We didn't know if it was going to be 1 or 2 patients, which, you know, ultimately we were lucky in this country that that's what it was. But it could have quickly, you know, intensified. A patient, you know, comes into our community and has Ebola. How many other people were exposed? So we considered very quickly that the way that we build the assessment was important.
If you think about Bellin Health's vision, and the people in our region will be the healthiest in the nation. That doesn't include just the people that walk in through our doors, it's everybody in our region. And NEW Community Clinic serves the underinsured, the low income, the people that may not hit our doors. This is a way to extend some of the tools and technology to the people serving that population to provide better health care.
So not only did we build the assessment for Bellin, we also built it for the 6 ThedaCare hospitals, and we all use the same assessment because our patients don't just travel to Bellin hospitals, they travel all over the area. If something were to be positive, what tools are going to pop up in Epic to help you to do the right thing? So we built best practice alerts to be able to say, hey, if the patient traveled but they don't have symptoms, reassess the patient later in 8 hours so that we can make sure that the patient doesn't develop symptoms while they're in our care. And if the patient was positive and they had positive symptoms, then we would say, hey, go put your PPE on, and all those steps were listed very clearly for the nurses so that it was easy to do the right thing and safe for the patient.
I know there isn't a single project we can do that doesn't take a team to make it successful.
This was an effort of a good, probably 40 people that worked on this. I feel like my little piece of what I do is it helps the nurses to give great care. So by being able to build the Epic screens and being able to build the workflows and being able to ask the right questions and be that interpreter between what the nursing world does every day with the patients directly and what I can do for the Epic system indirectly, I think is just, it's a very unique way to participate in the profession.
I think nursing, you can touch lives in so many different ways. So absolutely, being at the bedside, caring for a patient, caring for a family. But in IT, being able to provide those same nurses the tools and technology that allows them to take better care of patients, improved safety, efficiency, quality, all of those types of things, we're able to impact those patients in a different way.